Module overview. This module provides a foundational medical understanding of human anatomy and physiology essential for phlebotomists. The module emphasizes the cardiovascular, circulatory, and lymphatic systems, as these systems are directly involved in blood collection and transport. A solid grasp of body systems, especially venous and capillary pathways, is vital for performing phlebotomy with accuracy, safety, and confidence. The module also covers blood composition, hematopoiesis, venipuncture sites, arterial versus venous characteristics, and pathways of blood flow through the heart and vessels. By understanding anatomical landmarks, phlebotomists can ensure minimal discomfort for patients, avoid nerve or arterial damage, and increase sample quality. 2.1. The cardiovascular system, structure and function. The cardiovascular system is the central focus of phlebotomy. It is composed of heart, the pump blood vessels, arteries, veins, and capillaries, blood, the transport fluid, the heart. A muscular organ with 4 chambers, right atrium and right ventricle, deoxygenated blood, left atrium and left ventricle, oxygenated blood. Blood circulates through pulmonary and systemic loops. Venous blood is returned to the heart, pumped to the lungs for oxygenation, then sent through arteries to body tissues. Relevance to phlebotomy. Understanding this flow helps identify vein direction, venous pressure, and why certain sites are preferred for sampling, e.g., median cubital vein has steady flow and fewer valves. 2.2 Blood vessels. Arteries, veins, and capillaries feature arteries, veins. Capillaries direction away from heart toward heart, connect arteries and veins. Wall thickness, thick, muscular thin, elastic, collapsible, one cell, thick. Oxygenation, usually oxygenated, usually deoxygenated gas nutrient exchange site. Palpability, pulsating, feel pulse, non-pulsating, not palpable or visible. Phlebotomy, rarely accessed, dangerous. Common target for venipuncture, not used for direct access. Phlebotomists must recognize these differences to avoid arterial puncture, which can cause excessive bleeding or hematoma formation. 2.3 Blood composition. Blood is a connective tissue made of plasma, 55%, 90% water plus proteins, albumin, fibrinogen, hormones, nutrients, and waste-formed elements, 45%. Erythrocytes, RBCs, carry oxygen via hemoglobin, leukocytes, WBCs, fight infection, thrombocytes, platelets, clot formation. Knowing this helps phlebotomists collect the correct tube type, e.g., ETA for hematology, citrate for coagulation, and understand test relevance. 2.4 Systemic physiology. How blood affects body function, blood supports, oxygen and nutrient delivery, waste removal, immune surveillance, hormonal distribution, thermoregulation, hemostasis, and clotting. When drawing blood, phlebotomists affect the system by removing sample volume. Thus, they must be cautious with pediatrics, geriatrics, or critically ill patients. 2.5 Common venipuncture, sites and anatomical landmarks. In the antecubital fossa, inner elbow, 3 primary veins are median cubital vein, most preferred, large, stable, low pain risk. Cephalic vein, lateral aspect, deeper, harder to find. Basilic vein, medial aspect, close to artery, nerve. Use with caution in special cases. Dorsal hand veins, used when arm veins are not accessible. Foot veins, require physician approval, higher complication risk. Scalp veins, for neonates, landmark awareness helps prevent nerve damage and hematomas. 2.6 Hematopoiesis, blood cell production. Hematopoiesis is the formation of blood cells in the bone marrow, primarily in the flat bones, pelvis, ribs. All cells originate from hematopoietic stem cells. Knowledge of hematopoiesis is crucial when drawing blood for bone marrow suppression monitoring, chemotherapy patients, or CBC analysis. 2.7 Neurovascular considerations. Nerves often run parallel to veins, especially near the basilic vein, ulnar nerve proximity. Hand, wrist punctures, radial nerve risks. Phlebotomists must be trained to recognize signs of nerve damage, tingling, burning, shooting pain during puncture. Patient reports of numbness post-collection. 2.8 Patient positioning and posture. Correct positioning, arm extended and supported, veins visible without tourniquet. Initially, avoid crossing arms, which may obscure veins. Good posture prevents vein collapse, discomfort, and fainting. Learning outcomes for Module 2. Upon completion, you will be able to identify major blood vessels used in phlebotomy and their characteristics. Describe blood flow through the cardiovascular system and its relevance to blood draws. Understand blood components and their physiological roles. Recognize safe venipuncture sites and associated anatomical risks. Apply anatomical and physiological knowledge to ensure accurate and safe collections.